Our next speaker is Angela Ward, RNCOB, EFM, and CPRT. The name of her talk is Ketamine and Other Extraordinary States, a Nurse's Perspective. Here, let me bring this down. As the psychedelic pathway continues to open up, there are more and varied lenses to examine the ways in which we offer care for those going through these healing processes. Angela Ward, registered nurse and 2017 graduate of the Certificate in Psychedelic Assisted Therapy and Research at the CIIS program, will share her perspective caring for patients in more than 300 individual and group ketamine-assisted therapy sessions, and she has been involved with over 1,000 births. Her practice philosophy was shaped by her time at Seattle University, where the Jesuit values of social justice and education instilled in her a deep belief that all people deserve the highest quality of care, no matter what their means and resources. So let's welcome Angela Ward. Thank you.
Hi, everyone. So great to see you today. Well, let's see if the slides come up. How are you doing so far? So much information, and I just have so much gratitude for the previous speakers. I'm so grateful to be here with you guys today. Let's see. Well, let's just start with a story. I want to tell you about Richard. Richard came to our clinic with late-stage cancer. He had metastasized his cancer into his bones, and he was suffering from extreme bone pain and had taken so many opioids that he was maxed out. He couldn't take any more. He was completely gorked out. I'm sure some of you have met people on opioids, and they just get so inward. He was coming for his second ketamine-assisted therapy session. His first session was incredible. He had come down from a number of his opioids through the use of cannabis, and then in his first session achieved an incredible amount of pain relief. Like, his pain went away immediately, and then slowly started creeping back over the next couple days. In this session, however, he was coming because he wanted to address his mortality. Let me just see how my clicker works here. Where do I put it? There's so many buttons I get to push. Yep, not working. Can you send to the next slide, please? So Richard had been a traveler in his youth, and for this second injection, I'd asked him as we began going in and the medicine started working to go to his happy place. His happy place in this case was Varanasi on the Ganges in India, and he described being there in the early morning and seeing the sun come up, noticing the sounds and the smells as this city came to life. And as he looked around, he noticed there was a family there carrying flowers and incense. There were children. There were dogs barking. As the ketamine started to work more deeply, he followed his vision and followed the family as they approached a body that was being prepared for the funeral pyre. He watched as this family lovingly attended to this body, and he said there was no fear here. And then he said that he saw the river. He saw the sky. And his final words before he slipped into his full ketamine reverie was, "I am the clouds." When he returned from this deep dive session, and as he landed, he reported to me that he no longer feared his death. He felt that he was surrounded by his loving family, and that this was just a part of the process that was going to move him back into his own experience of being part of everything. He told me, "It no longer matters how many days I have left on this planet What matters to me now is the quality of those days. He became very committed to staying off the opioids and only using them as rescue medication as he needed. He was able to cope with his pain, and as far as I know, he's still thriving, which is really quite amazing. Thank you for indulging me that story. He was quite an incredible man so far. Can I have the next slide, please? So I'd like to thank you all for being here. I am so grateful for my own lineage, my ancestors that have helped bring me to this part of my life right now. I am so grateful for all of the teachers, especially the plant medicines and the chemicals that have taught me and taught others. I am particularly grateful for my teachers in this psychedelic work, and absolutely, first and foremost, my greatest teachers, my patients, who I've had the privilege and honor of sitting with as they go through these really incredible transformational experiences. May I have the next slide, please? So I have a question for you today. I am less interested in the medical model of psychedelics than I am in the psychedelic model of medicine. I don't know what that means yet. So I'd really, really like for all of us to consider what that might mean. We'll talk more about that for sure. May I have the next slide, please? So this is what we're going to talk about today. I had originally named this talk Ketamine in Non-Ordinary States, but really, these are extraordinary states. They are part of who we are, and we're going to talk more about that. We're also going to talk a little bit about ketamine, my experience working with it, and what I think the potentials are. I'm also going to talk about the medical model, some of the promises, and some of the pitfalls, and then we'll offer some thoughts. I also will like to take questions at the end, so hopefully I'll give enough time for that. It's important for me to let you know that I think ketamine is the litmus test about medicalizing psychedelics. So keep that in the back of your mind. How we're bringing ketamine therapy into the world is how we are probably going to be folding in some of these other psychedelic therapies. May I have the next slide, please? So talking about what extraordinary states of consciousness are, we need to know what ordinary states of consciousness are. So this is your normal, everyday to day way of existing in the world, probably how some of you are right now in that place of learning, maybe just having normal things like changing your baby's diaper, driving your car, playing games with your friends, writing a letter, that kind of thing. The normal hallmarks of an ordinary state is that you have pretty much a good sense of time, you have a sense of self, sense of other, and generally you can communicate pretty well. Can we have the next slide? So we're going to talk about what is an extraordinary state. They range from very mild to deep. So anyone that maybe has received a massage has been in kind of a mild, extraordinary state. Generally, people are you're a little more relaxed. You may kind of lose track of what time it is. With some deeper medicines, you are going to lose a little track of who you might be and who other might be. It can be a little softer, or it can be a complete disillusion of ego. You may be completely lost with who you are, or where you are, what time it is, and it is often very difficult to communicate from these spaces. So I do believe these are normal parts of our conscious experience, and it can be accessed in a number of ways. So I'm going to take you in a few slides just to look at what ways we can access extraordinary states. And I would request of you, as you look at these slides, take a moment to really look at their faces, at their bodies, and notice how you might feel in response to just looking at these. May I have the next slide, please? So of course, sex and birth, really one and the same, especially for women, is one of these ways we move into extraordinary states. The woman in the upper left has just given birth, and you can see her just full spectrum experience and expression there. What do you guys think is going on in this bottom picture? This is a woman giving birth. This is labor, although it's extremely sensual and beautiful. And then the picture in the top is the ecstasy of St. Teresa, which is a spiritual awakening for her. But you can see that she just has this beautiful, ecstatic state in her face there, which I think looks a little erotic, honestly. So if you're a little squeamish, you might want to cover your eyes a bit for the next slide. I just want to let you know it could be a little triggering for some people, but when we have the next slide, please. Pain is another access point to some of these non-ordinary states. This picture is sun dance. Anyone familiar with this ecstatic technique? Different piercings, which can release some really incredible hormones and move people into a new state. Let's move to the next slide, please. Of course, trance. I put these pictures up because I thought they were the coolest myself, but there are lots of ways to move into trance through repetitive movement. There are some historical dance practices, shamanic drumming techniques, different things that kind of can move you out of that ordinary state of consciousness into an extraordinary state. And I just love how this gentleman's face is just so, he's just in this beautiful space. Next slide, please. Some people also consider extraordinary states as flow states. I think it's really appropriate when anyone has had the experience of being in a flow state. You're just fully immersed in this. You can see that these partners are not needing to use language. There's just this being very present in the moment. This person surfing has to just be so responsive to what's happening in the here and now. And I think it's important to point out that these states can happen with one another. So it can happen with these people together. It's also happening across species, right? So we have this woman and her horse are just like so focused and moving forward together. May I have the next slide, please? And of course, shamanistic techniques and psychedelic medicine. And that's more what we're going to talk about here, of course. So we have the Anamita Muscara of Shamaness at the top. This is Maria Sabina holding the little children aloft. This is the Bwiti with their Iboga ceremony. And of course, an Ayahuascara here on the side. Let's have the next slide, please. So, language. I think in the context of healing, it's very important how we talk about these practices, this medicine and this healing. It's really important to use language that normalizes these experiences and helps widen the lens, that they are part of our normal human experience. So rather than saying an altered state, I really love the idea of extraordinary, non-ordinary, alternative even, trance, and in some cases, being in state. It's the concept we use when someone is within the experience itself. So what's wrong with altered? So altered tends to mean more, especially in the medical world, that it's pathologized, that there's something abnormal about it, and that there's a problem there that needs to be fixed. Can you click that one more time, please? Altered also implies neutering, right? And when we consider that something is altered, that means that it is less whole and vital. And I argue that this is such an important, essential part of who we are. I think that it's very important that we choose our language appropriately to reflect that. Thank you. So let's move on to the next slide. Let's talk about ketamine. Who here in this room has had some experience with ketamine or is a little familiar with it? There's a few. Wonderful. Well, I won't go into great detail about what exactly it is, but just so you know, it is an FDA-approved anesthesia drug that has been in use for about 50 years. It's very safe, has a really great safety profile. In fact, it's so safe it's used for children, it's used in animals. The World Health Organization recognizes this medicine as one of its essential medicines for countries to have on board. It's also recently become very interesting as a rapid-acting antidepressant medication. The thing that's so cool about ketamine is it does not suppress the breathing drive. It does not suppress the gag reflex. So unlike morphine, it's very much preferred in field hospitals, for example. But it does also induce these extraordinary states. A lot of people would consider it a dissociative anesthetic, but I've also had patients that I've worked with describe it as similar to 5-MeO DMT, but much gentler. In fact, I had a patient that once called it the Tesla of psychedelics. So I don't know, I'll leave that up to you guys and see what you think. What else can I tell you about it? There's a number of different ways to work with it. Recreationally, most people insufflate it, use a powder and snort it. If you do that, please test your stuff. Be very careful. I've worked in some situations where people have been drinking a lot of alcohol and then snorted ketamine, and it makes you vomit profusely. So be careful. The way that I was working with it was as a lozenge. Ketamine is available sublingually, but not orally. So it can either be used sublingually or rectally, and that can have a pretty potent effect. We can also use it intramuscularly. That's another method that I worked with it. And we used 1.5 milligrams per kilogram of body weight to 1.8, if you're interested. And it can also be used IV, intravenously. And some of you may have seen the plethora of IV clinics that are opening up around the country that are offering the promise of rapid antidepressant effects with IV ketamine. And it does work. May I have the next slide, please? So I cut the little J off here, I apologize, but this is actually Janssen from Johnson & Johnson. It's important, I want you guys to remember that. But what this slide is showing you is that this ketamine itself is an effective treatment for refractory depression and suicidality. It works like an SSRI works 2 weeks out. It takes a while for the SSRI to start working. Ketamine works now, essentially. So this slide is showing you that the response with ketamine within a day for people that have refractory depression compared to the placebo, which isn't even on there at a day, or to the standard therapies, such as different SSRIs, is hands down a winner in how quickly this can work. It's quite amazing. It also decreases suicidal ideation dramatically. So at the hospital where I worked, we had started using IV ketamine when people would come in with suicidal ideation. They just had a suicide attempt. We would give them a bolus of ketamine, and it would kind of break that immediately. I'm not certain exactly if it's because we tripped them in the ER, which could be part of what's happening, but this is what the evidence shows. But also, please remember this study particularly and who did this study. May we have the next slide, please? So here's some of the promises of ketamine. It can really offer an incredible reset. It allows people to kind of break out of this stuck place that they've been in. In fact, someone once described it to me as WD-40, psychedelic WD-40, just kind of break out of that situation. It also allows people to see things in a new and magical way, which is really incredible. Where there's trauma, it allows people to start growing into new life. And I'd like to share another story with you. A patient I took care of named Ryan. Of course, all these names have been changed, just so you know. Ryan was a young man who was really struggling with depression. In fact, he had made a suicide attempt and came to us so incredibly broken. The first time I met him, he was just like curled inward, protecting his belly. He barely made eye contact with me. And he looked like he was just carrying the weight of the world on his shoulders. So profoundly sad. Part of the reason that he was so sad, besides his own suicidality, was that his sibling had actually successfully suicided 3 years prior, and this was coming up on his anniversary. That's a lot of trauma for someone who's 20 years old. We worked together in a number of sessions, both individual ketamine sessions and then in group sessions, working mostly with intramuscular ketamine. In our first session, he told me afterwards that he experienced what it must feel like to be dead, and he really didn't like how it felt. So he decided he wanted to see what it might be like to be alive. And over the course of the time that we worked together, he started having these experiences where he felt one with the universe, part of this universal consciousness. He had a sense of being connected. He even had a sense of his sibling that had suicided and kind of making some peace with that. He grieved his lost brother. He grieved the pain that his mother had felt, not only losing one child, but possibly a second. And then he truly grieved what a violence he was about to perpetrate on himself. And he was absolutely heartbroken that he had felt that that was the only choice that he had. He was pretty remarkable. In the time that I knew him, he started meditating. He started jogging, which was something he always loved doing. He started running. He started reading books on mindfulness. He ended up going back to school. He started dating. He got a girlfriend. Things were pretty remarkable for this young man. But the moment I really knew that he had made such a transformation was when we were in a group ketamine session. And this was a small group. It was probably like maybe 6 to 8 participants plus 2 to 3 people, me or a couple other people holding space in this group journey. At the beginning of the journey, one of the participants reported that her brother had suicided earlier that week, which was, none of us knew that. We were quite surprised to hear that. And after their injection, their journey, and they were coming back kind of processing and talking together, this young man asked if he could speak to her in front of the group. She said, certainly. He said to her, I want to talk to you about your brother. I want you to know that this isn't your fault. There was absolutely nothing you could have done to stop this. And I want you to know that the next couple months are going to be really hard. But if you need anybody, please know that I'll support you through this. The fact that he could turn his own tragedy into medicine for someone else was remarkable. It was incredible to witness this transformation for this young man. And I'm hopeful that all of us that have tragedy, in whatever way that we are able to make that lead into gold, that we can offer in service of healing for others. There are so many stories. Thank you. Yes. So there are a lot, these stories are incredible. And I can tell you so many more stories of people like this. But there's a problem here. People hear these stories and they're hungry for healing. And when there's hunger, the market will fill it. May I have the next slide, please? The experience that I share with you today comes from firsthand knowledge. I worked in a clinic that moved through, in a microcosm way, of the macrocosm conversation of what's going on with psychedelic medicine right now. It is extremely challenging to marry psychedelics into a capitalist model that's run by insurance. I don't know what the answer is. Hopefully we can work on that together. But what I did see was situations like going from patient need to greed. Another brief story, I just learned about this earlier this week, was in Seattle there's a IV ketamine clinic. This person reached out to me to support this other person that had gone to this IV clinic. This person was struggling with depression. She called them up on the phone. They gave her a quick little phone assessment. They scheduled her an appointment. I believe that her therapy was supposed to be 4 IV sessions running $3,000 to $4,000 for this therapy. Just IV, no supportive therapy at all. This person went in, as far as I know, she had a blood pressure taken, like just the most basic set of vital signs. I do not believe she had a full mental health assessment nor physical health assessment. She had her IV experience. It tripped her pretty hard, even though they're using fairly low doses, usually 0.3 to 0.5 mg per kg. And after her session, she actually felt pretty good. And her family took her home, fed her some food. But they noticed as the night progressed, something happened. She became more and more paranoid. She started threatening her partner, saying she was going to call the police and say that he was sexually assaulting her. She took a hammer out and smashed her cell phone, and eventually got to the point where she was hiding in her bedroom in a corner. The next day, this family called this IV clinic and said, hey, what is going on? Can you help us? And they were like, oh, that's never happened before. That's wrong. You cannot open people up in a wide way like this and then blame them if they cannot integrate that experience into their normal life. It's not right. Also, she may not have been the ideal candidate for ketamine. That might not have been the right thing for her. We need to actually look and see if these medicines are appropriate for the people that are coming in for healing. And I absolutely acknowledge and recognize your right to your own liberty to do what you want with your consciousness. Please know that that's not what I'm saying. Explore a way. But we cannot, from a medical model, say, I'm offering ketamine, I'm offering MDMA, come and get it. That's not right. So going from this need to greed situation, what happens is we start having gatekeepers of access. This is a bigger conversation, and I'm sure if you dig at all into the psychedelic movement, you're going to run into this. Who are the people that can afford to pay for these services? Is it right that the wealthy can pay for these services? Are we truly healing people if we can only give it to the people that can pay for it? Or do we really need deep healing on multiple levels in multiple ways? Another concern is these IV clinics, and I'm very concerned that we are going to create like a factory model of psychedelic medicine. In this type of clinic, and this is the kind of situation where this person had been, that they're put in this wide open room, very medicalized, very disempowering. They're receiving a treatment instead of really being the conduits of their own healing and being supported in what actually makes sense for them. This is not an appropriate way to blast someone open with a psychedelic, with an IV in their arm. But what happens in an IV clinic, or even in a situation where we start making this model happen of moving people through, is if it's just the drug and not the relationship and the support of intention and integration, ketamine and these other drugs run the risk of becoming much like pills that you need to take on a schedule. That's a problem. There's so much more I could say about this. This is a complex and challenging situation. Another question is around cost. So that slide I showed you earlier with Johnson & Johnson, how many of you have heard of Spravato? Who knows about Spravato here? So Spravato is S-ketamine. That slide I showed you was research done by who showed the efficacy of ketamine, which is off-label, or it's not, off-label, it's off-patent, it's generic, it's maybe $2 a dose to treat somebody, maybe. Spravato is going to cost close to $700, $800 just for the medicine. That is wrong. They're doing that, Spravato was approved by the FDA because Johnson & Johnson was able to make a specific patentable type of medicine that doesn't actually show that it works any better than ketamine. And it is proved by the FDA now for treatment-resistant depression. Why are we creating a drug that costs so much more money when we already have a drug that works just as well?
Pay for the opioid lawsuits they're trying to settle.
That's a great question. Very much so. Like, who's profiting from this? My question to you, especially those of you in the audience that are healthcare providers in some way, do you believe that healthcare, including mental health, is a human right? Yes. Or do you believe that shareholders should be able to make a profit off these drugs that have the potential to save lives? We know that there is an epidemic right now of suicide in this country. The diseases of despair are at an all-time high. And I would argue that it's not, this is where I'm gonna get a little bit on my soapbox, so come along for the ride, you guys. So, what are the values that psychedelics call us to? I would argue that capitalism and psychedelics do not fit at all. At all. I am going to quote the bard, Mr. McKenna, if I can remember it for a moment. He said, what psychedelics do is they dissolve boundaries. And in the presence of dissolved boundaries, One cannot continue to close one's eyes to the ruination of the earth, the poisoning of the seas, and the consequence of 2,000 years of unchallenged dominator culture based on monotheism, hatred of nature, suppression of the female, and so forth and so on. You know how he says it, right? So, what might a psychedelic model of medicine look like? I'm not certain. But I'm going to ask those of you that are seekers of this medicine and those of you who are some providers, some thoughts that I've come up with. May I have the next slide, please? So, considerations for seekers. These are some things I want you to ask yourselves, and this is not comprehensive by any means. What is your why? Why do you want to work with these medicines? That's a really great question. Some people are psychonauts and they want to experience the full experience of consciousness. Maybe you've had a really profound trauma that you recognize is inhibiting you from living your fullest life in complete wholeness, and you're ready to kind of dive into that and work with that. What really matters to you as someone that seeks this medicine? Is it important to you that you might want to do this medicine with your friends at a festival or out in the woods? That's completely valid and wonderful. Are you more interested in, let's say, you want to work one-on-one with a therapist in the underground, with someone who maybe has little experience or maybe has a ton of experience and training? These things are really important to consider. Does it matter to you if the medicines that you're taking are still accessible? Are they endangered in any way? Are they being sustainably, ethically harvested? Maybe that doesn't matter to you, but it's important to consider if it does. And then please do your research. If you are interested in working with psychedelics on some level, learn what they're about. Learn what some of the risks are, in addition to the benefits. Because we are at a psychedelic conference, and we're pretty much all in agreement, I think, that they're great. And they do come with some inherent risks, and it's important to know that. And safety. So, of course, I'm talking about testing your drugs if you're going to take these on your own. Know who you're getting them from. Know what you're getting. Know what to expect with them. And I'm not putting this just on the seekers. These are also people that might be providing these. It's important to know the safety of what you have. It's also important to know the safety of the people that you're working with, which leads me next to consent and trauma-informed care. We all have heard stories of people both in the US and abroad who have been either sexually assaulted, actually physically harmed, or in some cases even murdered by some people that have been working with these medicines. I'm not certain how we need to call these people out, but we need to talk about that. We need to understand that your no is valid through the entire experience. There is never a time, even in the deepest parts of your psychedelic journey, where someone who's caring for you can take advantage of you. That is absolutely wrong. And we need to recognize that most of our trauma comes from relational experiences, right? And so in relationship, especially in psychedelic medicine, it's possible to re-traumatize people. We need practitioners that are aware of this, and you need to ask for that as a seeker, that these people will know how to ask how to touch your body, what kind of support you might need, what kind of language you prefer. We need to think about these things. And now on to providers. Let's move on to the next slide, please. So, it's important if you are a provider of this medicine or you're working in the field around it somehow. Can we have the next slide? Hello? So again, I think it's also important for providers to think about their why. What are you wanting to offer this medicine for? Truly, I believe many of us are coming from a place of deep healing. Those of us in caring professions are here because we care about you and we hope that we can help heal you. But it's also important to look at your shadow. Are you doing this because you want some notoriety? Do you want to be the first person in your area that's offering this cutting-edge therapy? Do you want to be a thought leader? That's not necessarily shadow, but it's important. We'll get there. Thanks, Meryl. What's some other things? education and experience. I want to be very clear that ketamine is not MDMA. Psilocybin is not ayahuasca. It is important to understand, if you are a prescribing provider or you're someone that's offering these services, that you learn how to work with the specific medicines. It's really important. I understand there's a place in Colorado right now that is teaching psychedelic sitting. And part of how they're teaching psychedelic sitting is they're using cannabis ceremonies, which I think is fantastic, except one who is able to be with someone in cannabis is not necessarily prepared to be with them in ayahuasca. These are very different. So I think it's on us as providers to seek education and also, I believe, experiences. So we know what people are talking about when they're deep in the ketamine session and it's relatable. You understand what the experience feels like. I also very much believe those of us in professions that have published codes of ethics, that we pull that out, dust that off, and look at it. Because this work is calling us to be at our most pristine and balanced way of holding space and holding these people in their care. We cannot continue to traumatize people or be in this hierarchical relationship when really what we know is psychedelic medicines awaken the inner healing wisdom. We want these people to experience their own well-being and knowledge. And finally, for those of us in the health professions, we absolutely must stand up and discuss these health disparities. Who has access and who does not have access? All of the inequalities within this system. May I have the next slide, please? Thank you. Other way. Other direction. One more. So, what's the bigger question here? What are psychedelics calling you to? What is the sacred activism this medicine is calling us to? The world is on fire right now, guys. It's the truth. Can you just click that one more time, please? But I believe if you respond to the call of the medicine that's calling you in your own unique way, that we are going to be able to transform this planet into one that is healed. I very much would love to hear your thoughts about how we can do that. And I would love to take any questions. If you guys have any questions you'd like to discuss. There's one back there. Is there a microphone? It's coming.
I think I'm loud enough I can get it across.
Let the whole group see. If you want to ask your question, I can repeat it so everyone can hear.
So, in your experience working in the medical field, I'm in the medical field as well as a medical administrator. What has been your experience with what is your most prevalent disqualifying mental condition that you see working with psychedelics? What are some things that you would say these mental states or mental disorders or whatever would be a no-go for working with psychedelics?
So I want to be clear that I am not a prescribing provider. I'm an RN, so I'm not a one that can prescribe ketamine or these other psychedelics, although the question is, what would be a disqualifying mental disorder for working with psychedelics? And I'm only going to be able to speak to it from ketamine itself and understanding that I'm not a prescriber. But one thing that we did exclude were people that had a bipolar 1 diagnosis. It can really open up a wide range of response. People can get pretty high and pretty low. So, but we did have some bipolar 2 folk that had a lot of support and connection, and it actually was really stabilizing for them. I think it was more related to the supportive therapies around it. It's a great question, thank you. Yes?
I'm a mental health professional, and I work with people with emerging psychosis.
Yes.
Okay. I'm a mental health professional. I work with people sometimes who have emerging psychosis, and I'm really interested if there's been any research at all with how to use similar setting with people who really are basically having a bad trip.
Well, I don't know about research into this area, but I can say, having worked in harm reduction at festivals, you absolutely get to experience that. Some drug-induced, some not. Sometimes it's just a wide-opening experience, and in those situations, it's really been a question of keeping people safe and helping them kind of process what's going on, helping everybody feel grounded and doing some nourishing care. As a nurse, the thing that I would do for someone like that is make sure that they have a blanket and make sure that they have some snacks and, help them just maybe play with bubbles or something to just settle into being cared for. But I don't actually know about research. Does anybody know of any research around that? Yes.
Okay, so what I'm more interested in is working with it in the same way one would work with approaching some hard stuff in an induced experience, because it's there anyway. The experience is there anyway, that they're already entering. I mean, a blanket, I'll give them that in the moment, but I'm talking about working with them over time as they try to deal with an ongoing experience of seeing some really hard stuff.
Yeah, okay. So for integration, again, because as a nurse, my orientation is really into journeying alongside somebody. I'm not fixing a pathologized, broken thing. I'm really asking people to notice what's coming up for them and how it might be making sense for them. Is that kind of answering what you mean? So in that situation, it's helpful to be kind of mirroring or reflecting back what their experience is. And I also think it's really important to recognize that these opening states, be it psychosis or some other things, they take time to recover from. It's not like you go in the weekend and you do your ayahuasca journey and then you go back to work on Monday and it's like back to normal consensus reality. It takes a while to kind of have it all make sense. Does that answer your question? Thank you. Yes.
There is a researcher in the Czech Republic. Her name is Rita Kosova, I believe.
Yes, I know Rita.
And she did a presentation at the World Ayahuasca Conference on the prophylactic effects of psychedelics, trying to, in the early stages of mental illness, trying to use psychedelics to ward them off.
And her speech was recorded, correct? I believe. Rita, what was her last name?
I believe it's Kosovar.
Yes. It was quite a lovely talk, so if you can get onto the videos from the World Ayahuasca Conference this year, I think there's a lot of information in that one. But what does that mean, right? What does that mean if we have this placebo effect? If we know that part of the diseases of despair that people are experiencing right now are really because of disconnection from one another and losing our sense of community, right? When we start having these really powerful connections together, especially with things like MDMA or even ketamine at lower doses can be a little more relational, we're allowing a connection to happen, that we're reconnecting together as a community in a way. And that in itself is profoundly healing for people. Yeah. Any other questions?
Yes, I'm a mental health professional.
Where are you?
I'm here.
Jump around. Okay, I see you. Hi!
Okay. I'm curious about dosage.
Yes.
And you mentioned that unlike something like opiates, the respiration rate and gag reflex are not affected. Mm-hmm. So I'm just curious about how that dosage gets gauged as, a therapeutic dose, even if you can just speak off the cuff on
Yeah,
that.
sure. I did 2 different ketamine trainings after the certificate program. So I worked with Phil Wolfson, and I've also worked with Donna Dreyer and Richard Jensen in their ketamine training. And they have 2 different schools of thought. So at the time, Phil Wolfson was working mostly with lozenges that were 100 milligrams of ketamine per lozenge, and they were sublingual or rectally administered. And my understanding is that even that way, there's only about 30% bioavailable. With intramuscular injections, that was 1.5 milligrams to 1.8 milligrams per kilogram of body weight. It depended a little bit on the person, but those injections were definitely, for the most part, psychedelic for people. And what I mean by that is they were completely immersed in the experience. Some people had very profound visual experiences. Some people had a lot of synesthesia, which is a hallmark of ketamine, where they would see the music or feel color or something like that. They wouldn't necessarily be outward. The lozenges could be a little more psycholytic doses that were relational. I guess, so when I said 100 milligram lozenge, 30% bioavailable, it's like 30 milligrams essentially, right? We were generally working with, I'd say, maybe 110 milligrams to 160 IM. Yeah, that'll get you there, for sure. I should mention real quick some of the side effects is that ketamine does increase your blood pressure and increases your heart rate. So people that have high blood pressure typically, if it's uncontrolled, we didn't work with it. But if it was controlled, we would make sure that their blood pressure stayed within a reasonable range. The most common side effect that we would see is it caused nausea and vomiting. I'd say I saw that in probably a third of our patients, so we would usually preload with Zofran or ondansetron. And we'd also have people not eat for about 4 hours, but then eating afterwards oftentimes would kind of make that nausea go away very quickly. There is one risk that I think it's important to know about with ketamine, especially if it's done intramuscularly, is it can cause laryngospasms, which can inhibit breathing. And that's not because of the ketamine, it's just kind of how the body responds. And it's very, very rare. I've only had 2 patients that's happened with. And all you have to do in that case is roll somebody on their side and help clear their airway. So it usually resolves very fast. Thanks for that question. There's a few more.
Comment for this question?
Yes,
Well, yeah, I'm a mental health professional, and we actually do ketamine clinics. And we have so I have some insight into that. We have a lot of problems getting patients willing to do psychotherapy with the ketamine. So that's been a big obstacle. And of course, insurance won't pay for it. But with Spravato, you mentioned, which is the S-ketamine, which, by the way, for 1 month, it's $6,000 to $8,000 just for the medicine. And that doesn't include the administration of the medicine.
No, that's wrong.
But one of the problems with you call the medicalization is they call the dissociation a side effect
Absolutely.
or adverse effect
Yeah.
that has to be dealt with.
Yeah.
When I say dealt with, I mean usually pharmacologically, like giving them a benzodiazepine or something. So they're
idea.
really devaluing the entire experience. And the other thing that Jansen is trying to do is create to minimize the dissociation.
Yeah.
And we're trying to maximize the dissociation.
Yes.
So that's the real big obstacle that we're
Agreed.
having with the medicalization. And I'm afraid that what's happening with Spravato is going to have a negative impact on the field because of that, seeing that the goal of the pharmaceutical companies is to reduce the whole psychedelic experience.
Thank you for that. I'm in 100% agreement. Those are some of the huge problems is patients don't understand that. But that's part of the education as the seeker, right? Like if we're going to do this, we need to recognize that these are not drugs that fix the problem. They are a tool. They are a potentiator for healing. And we can only make healing truly happen if we put it into like the container of the self, supported by the community. So I don't know the answer to that. That's one huge problem, and that's part of my question is, what is a psychedelic model of medicine? Any others? How are we doing for time? Are we there almost?
Angela had a question for you. Thank you so much. What does the treatment for depression look like? I mean, how often are they treated, for how long, et cetera?
It was hard to say. It varied. I was working for a startup. I no longer work there. Startups are fun. Things change a lot. But the time that I was there, we were doing generally about 3 intramuscular, what we call deep dive sessions. So we would do an intake, a deep mental health intake was about an hour long. And then we would do a preparation session that was separate, about an hour as well, where I would meet with the patient as well as the provider. I would tell them kind of what the experience would be like. We would talk about setting intentions and what that might mean. We talked about the care right around the window of time, kind of what they might expect their mood to be like. We did all intake assessments. We did ACE scoring, so the Adverse Childhood Experiences scoring, and resilience scoring. We did the GAD and the PHQ-9. So we did depression and generalized anxiety scales. And then we would do 3 deep dive sessions interspersed with a 1-hour integration session where we would talk about what happened. And sometimes that would just be with me as a nurse. If we could get them to work with our psychotherapy team, that was really great. So we go through the 3 of them, and then we would do a final reassessment. And we did show improvement in depression on the depression scale and the anxiety scale. And also it seemed to make the resilience score questions have more meaning for them. It was about about 7 weeks. Or not 7 weeks between treatments. The length of the whole program was, from intake to completion, was about 7 weeks. Thanks. Yes.
Thanks. So I'm a prescriber, and I do refer people for Spravato, and it's pretty crazy, the steps you have to go through, and even just getting them approved. And then, like you mentioned, the cost when compared to how cheap just compounded ketamine can be. So that's been bothering me, and I'd really like to increase availability to my patients.
Yeah.
And I'm wondering if you have any advice, or I want to get my patients intranasal ketamine. How do I do that? Is my board gonna freak out? Like, is there some, what do I do?
That's a great question.
Intranasal, like
Intranasally, I'm not
antidepressant.
certain. I know that it seems like intranasal ketamine is being covered for pain. As far as I know, this is not my area of expertise by any means. However, and I think we're going to talk a little bit more about this on the panel later on, it is time to be bold, people. It is time to be bold. And if you have prescriptive authority and you trust the people that you're working with, it is time to prescribe it. And I'm wondering if there might be a way to build something like a community acupuncture clinic. What if we made a community setting where people that didn't have a ton of money to spend but maybe we could have some volunteers, or we could have people that are skilled working in these places, like standalone Zendo-ish places where someone who's a prescriber, like you could write a prescription for a patient to have a ketamine injection in Washington State, where I am, let's say, and that person can go to the compounding pharmacy and pick up their injection, and as a nurse, can bring it to me, and under your orders, I can inject them with it, And we can have a safety protocol, and insurance might not cover it, but even if insurance doesn't cover it, it's not even anywhere near as close as Spravato. It doesn't make any sense that we're jumping onto the capitalist train. Like, what kind of medicine do you really want to offer? And, I know it's easy to have these bold ideas, but what are we doing? What are we doing, guys? Let's leverage our privilege. If you're a prescribing provider, learn how to work with it and leverage your privilege, and let's bring this medicine forward. How do you want this litmus test of ketamine to evolve into legalizing or decriminalizing the rest of these medicines? That's what I got for you. All right, I think we're at time. Yes. Thank you so much. It's been a real pleasure.